Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome, everybody. I'm so excited. We have been talking about our Gold Lactation Online Conference 2024, and it is almost here. We are doing lots of interviews and trainings and just really getting excited about the knowledge that is in the world today. Let me tell you, just when you think that you know everything, there is so much more to learn always in the field of lactation. And with our amazing international audience here today, as well as our international speakers, we have Swati Temkar. So welcome, Swati. It is so good to have you here today. Thank you for joining us. We have had lots of time to work together, get ready for the conference, training. You have been working on an amazing presentation, and I know you're going to be sharing a story of your journey and some of the things that you do to care for your mothers. But
Yes,
please tell me where you are in the world. I want to know what part you're in and tell me what your work looks like there as well.
yes. Hello everyone. I'm Swati Temkar, IBCLC from India, Mumbai, Maharashtra, India. Okay, and I am IBCLC since 2010, and 2002 to 2010 I was a lactation counselor. I passed exam in 2010 and again recertified after 10 years in 2020. I am working in a pediatric clinic with Dr. Prashant Gangal, who is my mentor, and I am with him since almost last 24 years. So I
Wow.
have working experience in the pediatric clinic is almost of 24 years. Plus, initially I worked in small maternity home almost for 14 years, and I am with the organization BPNI Maharashtra. I
Hmm.
have my private practice. I do home visits or in the hospital OPD, I see the patients. I attach to SL Raheja Hospital and Leelavati Hospital, which are the prime institutes in Mumbai, Maharashtra. Plus, in addition to that, once a week, I go to government institutional hospital, that is Sion Hospital in Mumbai, Maharashtra. And as my private practice, I do home visits also and lot of work. I am a trainer, BPNI trainer, senior trainer since almost last 20 years, and working with BPNI since almost 20 years. And we go for a training with support from UNICEF. So I go as a faculty for different levels of workshop like level 1, level 2, level 3. Plus we do hands-on training for IBCLC appearing candidates. And that's all. That is my introduction.
Well, I know that you do many things, and it is so beautiful. You've had such an expansive career, and I know that things have changed a lot since you first started. And so, tell me, when you became an IBCLC in 2010, how many IBCLCs were in India at this time? Just how many were there, roughly?
Yeah, approximately 60, 70.
Yeah, so not many. And now it is
Not
growing
many.
though. It's growing,
Yes,
correct?
yes,
Yeah.
yes. Yeah.
And that's thanks to you and many others like you that are training and bringing awareness because there are plenty of mothers. There's plenty of
Yes.
mothers that need support in your
Yes.
community as well. Tell me, when did you start becoming a BFHI assessor? Because for people listening in, Baby Friendly Hospital Initiative, you go into hospitals and
Yes.
assess to see if they
Yes.
meet the criteria.
Yes. I go as a faculty for BFHI assessment. So we do staff training. Then we ask some questions to mothers because we really don't know that staff will always tell us everything is going well.
Sure.
So some questions we need to ask some ayabais or some nurses, then obstetricians, pediatricians, and we speak also with mothers. And after assessing, we have a BFHI program, we have a BFHI form And after filling the form, then we decide whether to certify this hospital as a BFHI or not. And if the breastfeeding practices are not satisfactory, then we always suggest the hospital that you do these changes, whatever suggestions we give them. And
Sure.
then again we go as a assessor maybe after 3 months, and then assess the hospital again.
Yeah. Yeah, that's amazing. And I appreciate that. We do in my community in Canada, we do have a few baby friendly hospitals.
Yeah.
And I feel like it makes a difference. I see the changes. I hear, I work in private practice like you, Swati. And so when they come home from the hospitals, you can hear the difference in language and what they have been taught, and I think they're, definitely better success. So definitely appreciate you doing that. Let's
Yeah.
talk about your topic. Now, your topic
Yeah.
is there are just a few things I want to touch on today. So accessible tools and techniques for relieving breast and body pain while breastfeeding.
Yes.
Now, these tools that you have found, these are accessible tools. These are tools that people might have around their homes. And so interesting because we were talking about some of the things that mothers think they have to buy in order to be able to be successful. They have to, parents today, there are so many things that are, in the market. I have to have this, I have to have that, and it's expensive.
Yes.
It's expensive to be a parent. But not only that, that breastfeeding as a whole can come with different challenges. And I think that you and we talked about some of these challenges. And we said, sometimes we look beyond the obvious. Sometimes it's just a small change that
Yeah.
you need to make in order to actually be successful, have a parent, be successful. So sometimes it's about coming back to the basics and reviewing the essential components. We even talked about the latch. And you and
Yes.
I said you said predominantly it's all about that latch being too shallow, correct?
Yes.
Yeah. And so tell me in your time, have you always had this look when you go into a family in their home? Have you always thought about, okay, what is around the house that we can use right away? When did this start to become something that you were able to just constantly put together? When did you first discover these things?
Almost something like a bolster. It's a type of cushion only that I discovered almost 7, 8 years back.
Right.
And then gradually, I started thinking that why should insist mother to spend on breastfeeding pillow or some other thing? I mean, it's not bad, but
Sure.
using home pillows or home equipments that will save mothers money, and some mothers they are not affording. So specifically, I suggest those mothers that you try to use the home equipments. I will help you for that, and the breastfeeding will be easy for you. One more
Yeah.
thing, I have a design a concept of painless breastfeeding, and my
Yeah.
presentation, my topic is basis on that concept that mother should avoid different types of pain.
Yeah.
Because when I meet the mother, first she always tells me that I have less milk supply, I have bad nipple pain while feeding, my baby bites me, so I am unable to feed. Then some mothers they complain about their back pain, that I bend over the baby, so my back always
Yeah.
starts paining. So what I feel, and the concept I designed, that mother should avoid four types of pain. Number one, back pain. Two, hand or wrist pain. Stitch pain, specifically in reference to LACS mother after C-section, because the dressing is at lower incision, so lower segment. So it is unable to hold the baby in cradle or cross cradle position, or to keep
Yeah.
difficult to put the pillows on the lap. So mother should avoid stitch pain, and she should avoid nipple pain. So this I'm talking about these four pains and these four types of pain, and how to avoid this pain by using different home equipments.
Yeah.
And I am routinely trying all these equipment in my practice since last many years. And after COVID, it became very helpful,
Sure.
because many people, they were working from home during COVID. So different things like laptop table they purchased for working from home. So I use
That's
that
right.
table for the feeding. Yeah, and I have many photographs of my cases that I already put in my
Yeah.
presentation.
Yeah, it definitely it's very interesting to sort of go back and think, okay, there's all these types of pain that our mothers are in, and how can you be successful when she is already suffering? And I think it's so important, to sort of it's almost like you stripped away all the complexities of how we can really get ourselves into a lot of trouble, if we're not clearly addressing the
Hmm.
primary issues
Yes.
of feeding successfully, and then utilizing things around the home so that it doesn't become another barrier financially, or the fatigue of thinking, what do I have to have now in order to breastfeed? So very, very smart. I'm really looking forward to your presentation. Thank you so
Thank you.
much.
Yeah.
You will get to see these great videos and photographs that, of course, Swati graciously has showing us in the presentation. So stay tuned. Come and join us at
Yeah.
goldlactation.com. You can go over to the website right now and, of course, register for this event. Many of you have already registered, which is so exciting. You can check out the schedule, particularly come and sit with Swati and myself. We'll have a live Q&A, and she will be speaking live, of course, at our conference. Accessible tools and techniques for relieving breast and body pain while breastfeeding. Thank you so much, Swati, for being with me here
Thank
today. And I will look forward to seeing you all on the live day. Thank you again. Bye-bye for now, everyone.